Jody, the rib, if it is a stuck rib joint, they're pretty easy to treat. The rib articulates with the vertebral body, so it bumps up against the vertebrae, and in some levels against two vertebrae and the disc in between. But it also makes a joint with this lateral projection called the transverse process, full of ligament. Lots of ligament, lots of muscular connections. So it takes a little while to move a rib. I just don't believe in thrusting ribs. I think that's a terrible way to treat it. I understand that the rib is prominent and it's somewhere in the lower area maybe. But anyway, so if there was a twisting injury and the rib got stuck in a lateral fixation, then what you want to do is you want to gap the joint, you want to open up the joint so that you'll then be able to move it inward. So what you do is you make sure you go to the middle of the spine, okay, and then you come out about 2 inches to make sure you're not on the transverse process. And you can test motion of that rib. You can push it in at about a 30 to 45 degree angle in towards the spine. And then you can also spring it a little further away from the spine, 30 to 45 degree angle. But it might be stuck in both directions. If it's prominent, then it probably is twisted outward and needs to go back inward towards the spine. And the way you do that is you first push it straight forward. And that's getting some gap. Okay? So you just stack your thumbs or the heel of your hand and just push straight forward towards the floor. Do that for 30 seconds. And that'll kind of take up all that little available movement. Okay? Then you're going to change the vector to a 30 to 45 degree angle. And you might be able to test like which angle is the best because you'll feel a little bit of yield. Okay? So then you change your vector this way. 30 to 45 degree angle, and you just gently lean on that, very, very gently, about 5 pounds of force, and you maintain that force for 3 minutes. Okay? If the rib is stuck in, then it would probably appear to be deeper. Okay? If the first treatment is painful, then maybe it is stuck inward, and I can appreciate that that might also make this part prominent. So both ways can make a certain part of the rib more prominent. If the rib is stuck in, that can be quite painful. Okay, and the technique is similar. You come onto the rib, and you push a little bit laterally, but mostly anterior. You're going to gap that rib off of the vertebrae and off the transverse process. Okay. And then you're going to change your vector to about a 45 degree angle, trying to move that rib laterally. And a broad contact on the outside of your hand is very good for that. Okay? So I hope that's helpful. Whenever I can make it in town, I'd be happy to look at her. I hope that helps. Let me know if you have questions. Thanks.